So let me get into the benefits of prostate massage and also how you can do a prostate massage. Now, here's the thing. You probably don't want to wait until you have prostate problems before you start doing the prostate massage. I think the prostate massage should be something that men teach their sons, and this should be a tradition that's kind of handed down, because I think it would keep us out of a lot of the health situations that we find ourselves in. So when you're thinking about an enlarged prostate, one of the big things is it obstructs urine flow. It can actually obstruct ejaculate, and it can interfere with erectile function. Those are the three main things that it can do. Now, when your prostate is working regularly and you're not having any issues, usually we've got good urine flow, good ejaculatory flow, and nice hard and stiff erections. So back in the day, to the point where they were even prescribing riding a horse with a saddle on it as part of prostate care back in the 1800s. That's how clear cultures have been on prostate massage until we did away with it and came up with a bunch of medications, okay? And it makes sense if you think about it, right? Anything that deals with fluids and has a spongy type of material, every now and then is going to need to get massaged and cleared out, right? So I want to share with you a picture of kind of the anatomy of what we're dealing with when we do an internal prostate massage versus an external prostate massage. So the whole concept of an internal prostate massage, and I'm going to demonstrate on this apple. It is organic. I do walk the walk and talk the talk and all that good stuff. So this is an organic apple that I'll be eating after this. Now, think of this part as actually being the rectum. The concept behind the prostate massage is that we want to get into the anus behind the prostate and stimulate not just the prostate, but the ducts or the pipes that go in within the tissue. See, within the tissue of the prostate, not only do you have the ducts that, like the big one where the urine is passing through, right? The urethra. You also have the ejaculatory ducts. So you have potentially three big pathways that can be blocked up over time, or because the tissue has become enlarged, they are blocked up. Maybe there's some fluid stuck in there or some stones in there. That's one thing, but they can also get blocked up just because of the size or the growing part of the prostate. And when you think about a massage, I want you to think about any part of you that's gotten stiff or got a little kink in it, right? If you get in there and you get someone to massage it, or you get a little massager, you're like, oh, I feel so much better the next day, right? After that massage. Well, I think the prostate massage is definitely a comparable thing. And so when I'm actually talking to a patient about doing prostate massage, I get so much pushback. They're like, well, I mean, it's the butt area, blah, blah, blah. Is this going to hurt? And you and I both know that sometimes when you sit on that toilet to poop, things this size come out, right? So a prostate massage, internal one, particularly if you relax and breathe through it, shouldn't really hurt. Now, it may be uncomfortable at first, but if you do kind of a breathing exercise, and the breathing exercise that I actually subscribe to is one where you're just kind of breathing in and breathing out. And then it's almost like you are breathing out. And when you exhale fully, you're actually releasing and relaxing the anus area, right? It's just like taking a poop, right? And so what happens, and this is what happens when people are having, when you're deciding to have anal with someone else or whatever, what actually happens is that when you clamp down and release it, it actually almost forms a little bit of a pulling sensation to the point where it actually helps it glide in. So if you're doing an internal prostate massage, you have to have a lot of lubrication present, and then you have to relax. And honestly, one of the best positions for a prostate massage or anything related to anal is actually one where you're kind of stooped down, because it opens everything up there. But if you're not, and you happen to be laying on your back, or laying in a fetal position, which is a really great position to do it, then it's really about bearing down, clamping down, and then releasing it and breathing through it. And you're applying just a little bit of pressure right at the external area with the lube, and it just kind of slides in there. So it's not about pushing it in there or pulling it in there. When I'm doing a digital rectal exam, I'm not just jamming my finger in there. I'm having you relax. I'm having you take deep breaths. I'm actually putting lubricant on my finger. And then as you kind of push down and relax, then I just gently advance. And that's why my prostate exams don't hurt. And that's why when you're doing an internal prostate massage, it shouldn't necessarily hurt either. A little uncomfortable is different than hurt. Remember, your poop this morning was about this big, right? So we'll also talk about external massage, because I think it's important for you to know that there are two different types. So when you're doing an internal massage, right? And I have links to internal massagers and external massagers down below. So when you're doing an internal massage, really, so you're taking a deep breath, taking a deep breath out, and then you're clamping, and then you're releasing, all of the while of just pushing this right at the entranceway. You're not ramming it in, and you're just kind of putting a little pressure on it. Now, this is all lubed up in this process, right? And so then when you take your deep breath in and you relax and you kind of push and advance a little bit, you always want to know that your prostate is going to be located towards your belly. So you're actually going to angle the massager towards your belly, towards the penile tissue, right? Because that's where the prostate is. So once you're actually inside, you're angling it forward. And if your massager does not vibrate, then what you're actually doing is you're doing dick ups or Kegel exercises while it's inserted, right? And so what you're doing when you do a dick up or a Kegel exercise is that you're clamping down on the anal tissue, and what it's doing is it's causing it to do this motion. And every time you clamp down, the muscles of the anus kind of move it a little bit, right? And then you release it, and then move it again. So really, if you're using one that you don't necessarily have any vibration to it, just doing your Kegel exercises while it's in there is actually part of the massage. Now, technically, I prefer to get down to business and actually, have a little vibration there for the process. You want to start with basically a probe that just lets you locate your prostate so you know where it is. You know it's your prostate because if you do it the first time with a bladder that's kind of full, when you hit the prostate and you tilt it forward, you'll actually have this sensation, almost like you have to pee, because you're pushing on the prostate, and the prostate is right beneath the bladder, which is right beneath your penis, which is right above your penile tissue. So it really kind of stimulates this sensation of that you have to urinate, so you're on your prostate. So if you're using this kind, then you're just kind of clamping down and doing the exercises, and that's serving as your prostatic massage. If you happen to have a vibrating device, then what you're actually doing is your tissue is vibrating, and what you're doing is you're still doing the exercises while it's in there, but you're letting the vibration kind of run and letting the vibration do its thing. So you don't have to worry as much in that direction as to what's happening with the movement of it, right? Now, when you're doing an external prostate massage, I want you to know that we can have benefits either way. I am a fan of internal and external combined, but I know that we've got to talk baby steps here, because when I posted the video on prostate massage, I think I got some hate mail. Nobody wants to think that this is something that gentlemen should be doing. I even had someone accuse me that I was trying to make men gay and homosexual. So I assure you that my time here is to help you be the best version of yourself and nothing but it. And if I didn't believe very strongly in prostate massage, I really wouldn't talk about it, because it has gotten me a lot of pushback. But I want you to understand why this is so important. So let me get you a little bit of an image here. So I'm going to share my screen so that you can see what I'm talking about. And so that you can know I'm not just some lady making this stuff up, and that there's a whole reason why we're doing all of this. If you decide to do the prostate externally, this is what this looks like. So you want the vibration or the movement, or whatever you're using to stimulate the prostate area, you want to hit this area right in here where this external massager is located, right? You want to take this area and you want to take your massager. I dropped mine on the floor. It's been one of those days. You want to take your massager, you want to turn it on, and you want to take, and you're probably going to approach it from the front because it's easier. You want to take and put it right in that area that we were just talking about, the gooch, the tank, whatever you want to call it, the area right in between your anus and your testicles. And you are going to, start slow and low with it. And you're going to use this and you're going to go back and forth on that area. You're going to apply pressure. Pressure is our friend when we're talking about most of this stuff. So we're going back and forth. Now, prostate massage too is definitely contraindicated if you have an active prostatitis going on. Not necessarily chronic prostatitis, but if you're already in pain from your prostate, you don't want to aggravate your prostate with a massage. The other thing is, if you have active prostate cancer, you have to speak to your doctor, because honestly, if you are going inside of the anus and massaging your prostate, there are incidences where you could actually be doing seeding of the cancer to other areas, and outside of it. So prostate massage is definitely something that you want to get cleared with your doctor, but you would take the massager, turn it on, you're hitting the perineum and you're going back and forth with it. You can even take it and just sit on it and let that, you put a little pressure on it and just let the vibrations penetrate. Because if you look here, you are penetrating the bulb of the penis, which is where the bulb of the penis is where our nerves and our blood supply culminate to go through. So you're penetrating through the bulb of your penis, the bulbourethral, urethral area. You are penetrating through to your prostate. You're penetrating through to the prostatic or urethra, and you're having the benefits of the massage. Now, you can also do the same thing with a hard or semi-hard ball that you're rubbing back and forth on your seat. So when you're sitting down, I want you to kind of think of potentially, what could I be doing to benefit the D while I'm sitting? Can I do a bit of a prostate massage? Can I be doing my dick ups, right? Can I stand up every 15 minutes or 45 minutes and put myself in a squat position, right? Because when we're sitting all day long, we're sitting on these important nerves, these important arteries that are supposed to be bringing blood flow. And because we sit a lot during the day, particularly for my guys who are in the transportation business, or even those of you who sit in front of your computer all the day, it is wreaking havoc on things. So you can do the external prostate massage. You want something that vibrates, or something that you can kind of get a little movement on and kind of stimulate the area that way. Or you want to do something where you're actually penetrating and attacking the prostate internally. Attacking is probably not a word I should be using, but you're getting the prostate internally because you're actually getting from the posterior side of it. So if you think about it, our prostate is a three-dimensional object, right? And so it's got sides on it. So if you're going internal with your prostate massage, you are impacting the prostate from behind it. If you are doing external, you are more so impacting your prostate from below. Now, there's a third type of prostate massage too that's easier if you're a smaller gentleman, right? Because what we're doing when we're doing the third version, and this is an external prostate massage too, is you're actually trying to get to the prostate from the top. And so what you're doing is you're lying flat on your back and you're actually looking for that bone, you know, that pubic bone that you feel kind of down below by your pelvis, and you're actually taking your hand and you're penetrating deep that way, so that what you're actually doing is stimulating from the top, but you got the bladder on top, then you got the prostate below it, right? So we've got 3 different versions of prostatic massage. All of them can make a huge impact and a huge difference. Some of you are messaging me that you are 2 days into the prostate massage and feeling better already. So speak to your doctor about whether or not prostate massage is right for you. But for those of you who all of a sudden get ED and you're living a very healthy life, think prostate and think nitric oxide levels, okay? Great.